I collapsed on the floor of the hospital waiting room, clutching my chest as pain radiated down my left arm. Through blurred vision, I saw my son David standing over me, his phone pressed to his ear. "Amanda, it's serious. Mom's having a heart attack. They're saying she needs emergency surgery." He paused, listening. Then his face hardened. "No, I know. But we can't afford it. The baby has to come first." I tried to reach for him, tried to tell him I'd figure something out, but the words wouldn't come. The last thing I heard before the paramedics rushed in was my own son saying, "I'm sorry, Mom, but I can't help you with this." I know it sounds impossible. I know it sounds like one of those stories you hear and think must be fake, but I swear on everything I love that every word I'm about to tell you is true. And if you give me just a few minutes, you'll understand how that moment in the ER changed my life forever. My name is Margaret. I'm 68 years old, a retired nurse who spent 40 years taking care of other people's families. I raised David alone after my husband died when our son was just 7. I worked double shifts at County General, skipped meals so David could have new shoes for school, and put myself through night school to become an RN supervisor just to afford his college tuition. For 40 years, I gave him everything. And when I needed him most, when my own heart was literally failing, he walked away. The pain had started 3 days earlier. I ignored it at first, the way nurses always do. We're terrible patients, always thinking we know better, always believing we can push through. But on Wednesday morning, while I was volunteering at the community clinic where I'd been working since retirement, the crushing pressure in my chest became unbearable. The doctor there, a young resident I'd trained years ago, took one look at my EKG and called an ambulance. At the hospital, they ran tests. A cardiologist I didn't know, Dr. Sarah Chen, came into my room with a grave expression. "Mrs. Patterson, you have severe coronary artery disease. 3 of your main arteries are significantly blocked. You need bypass surgery, and you need it within the next 48 hours. My hands started shaking. "How much will it cost?" "With your Medicare, you'll still have out-of-pocket expenses of around $30,000 for the surgery and hospital stay." $30,000. I had $1,200 in my savings account. My pension covered my rent and groceries barely. I'd never been good with money, always giving it away to David when he needed it, helping with his wedding, his down payment on the house, his car repairs. "I'll call my son," I said quietly. David arrived an hour later with Amanda, his wife of 3 years. I'd never particularly liked Amanda. She was the type of woman who smiled with her mouth but not her eyes, who always had a comment about my outdated clothes or my shabby apartment. But David loved her, so I kept my mouth shut. "Mom, what's going on?" David sat in the chair by my bed, looking uncomfortable in the sterile hospital room. I explained everything the cardiologist had told me: the blocked arteries, the urgent need for surgery, the cost. "I hate to ask, honey, but I don't have the money. I was hoping maybe you could help me with a loan. I'll pay you back, I promise. I can get a part-time job after I recover. Or—" "Mom, stop." Amanda's voice cut through my plea like a knife. "We can't help you." "Amanda, please," I started, but David was already shaking his head. "She's right, Mom. We just can't. Amanda's pregnant. We're having a baby, and we need every dollar for the nursery, the medical bills, everything a baby requires." My heart, already struggling, seemed to crack further. "A baby? David, that's wonderful, but this is my life we're talking about. And this is my child's future." Amanda stood up, her voice rising. "We've been planning this pregnancy for months. Do you know how much it costs to have a baby in America? Do you know how much daycare runs? We can't just throw away $30,000 on—" She stopped herself, but the damage was done. "On what, Amanda? On keeping me alive?" David wouldn't meet my eyes. "Mom, you have to understand. We have our own family to think about now. You had your whole life to save money. This isn't our responsibility." The words hit me harder than the heart attack. I'd spent 40 years making him my responsibility, and now, when I finally needed him, I was disposable. "Get out," I whispered. "Mom, get out of this room, both of you." They left. David glanced back once, guilt flickering across his face, but Amanda grabbed his arm and pulled him away. Through the small window in my door, I watched them stop in the hallway. Amanda was on her phone, smiling, talking animatedly. Not the face of a concerned daughter-in-law whose mother-in-law was dying. I turned my face to the wall and cried for the first time in years. 40 years of sacrifice, and this was how it ended. Alone in a hospital room, unable to afford the surgery that would save my life. Abandoned by the son I'd given everything for. An hour later, there was a soft knock on my door. Dr. Chen entered, and something in her expression made me think she'd heard everything. She pulled up a chair and sat down, not as a doctor but as a woman speaking to another woman. "Mrs. Patterson, I overheard your conversation with your son. I want to make you an offer, and I need you to hear me out completely before you respond." I nodded, too emotionally exhausted to speak. "I'll perform your surgery for free. No hospital bills, no surgeon fees, nothing. I'll cover all of it personally." My mouth fell open. "Why would you possibly?" "Because I need something from you in return. Something that might sound strange, but I promise you, it's important to me." She took a deep breath. "I need you to pretend to be my mother." I stared at her, certain I'd misheard. "I'm sorry, what?" Dr. Chen's eyes filled with tears. "My mother died 10 years ago from the same condition you have now. I was in my residency, working 100-hour weeks, and I missed the signs. By the time we caught it, it was too late. I've lived with that guilt every single day since." She wiped her eyes. "I have no family, Mrs. Patterson. My father passed when I was young. I'm an only child, and I never married. I built a successful career. I'm one of the top cardiothoracic surgeons in the state, but I go home every night to an empty house. And I would give everything I have to hear someone call me daughter again." "Dr. Chen, I don't understand what you're asking. I'm asking you to let me save your life, and in return, I'm asking you to be my family. Stay with me during your recovery. Let me take care of you the way I should have taken care of my mother. And when your son sees that you're not alone, that you have someone who values you, maybe he'll realize what he gave up." It was insane. Absolutely insane. This woman was offering to save my life in exchange for pretending to be her mother. But as I looked into her eyes, I saw the same loneliness I felt in my own heart. Two women who had lost their families, for very different reasons, finding each other in the most unlikely place. "Why me?" I asked. Dr. Chen smiled sadly. "Because when I was standing outside your room, listening to your son abandon you, I heard something else too. I heard you tell him to leave with dignity. You didn't beg. You didn't cry in front of them. You waited until they were gone. My mother was like that. Strong, even when she was breaking inside. She reached out and took my hand. I can't bring my mother back, but I can save you. And maybe, just maybe, we can both stop being alone." I thought about my empty apartment, about going back to a life where my son had made it clear I was a burden. I thought about dying on a waiting list for financial assistance that would never come. And I thought about this stranger who was offering me not just life, but a second chance at family. "Okay," I whispered. "I'll do it." Dr. Chen squeezed my hand, tears streaming down her face. "Thank you. I promise you won't regret this." The surgery was scheduled for the next morning. Dr. Chen assembled the best team in the hospital, and before they wheeled me into the OR, she leaned down and whispered, "I'll see you on the other side, Mom." The words sent a warmth through my chest that had nothing to do with my failing heart. I woke up 12 hours later in the ICU, groggy and sore but alive. Dr. Chen was there, still in her surgical scrubs, holding my hand. "You did beautifully," she said. 3 successful bypasses. Your heart is going to be stronger than it's been in years." The recovery was long and painful, but I wasn't alone. Sarah, as she insisted I call her now, visited every single day. She brought me books, sat with me during physical therapy, and told me stories about her childhood with her mother. I told her about raising David, about my years as a nurse, about my late husband, and the life we'd built together. 3 weeks after the surgery, Sarah came to my hospital room with a wheelchair and a smile. "Ready to go home, Mom?" Home? I'd assumed she meant my apartment. My home. Our home now. She wheeled me out through the main lobby, and that's when I saw them. David and Amanda, standing by the information desk, David's eyes wide with shock. "Mom? What are you doing up? Who is this?" Sarah stepped forward, her voice pleasant but firm. "I'm Dr. Sarah Chen. I'm Margaret's daughter." Amanda's face twisted in confusion. "Margaret doesn't have a daughter." "I do now," I said, surprised by the steadiness in my own voice. "Sarah performed my surgery and covered all the costs. She's been taking care of me every single day." David looked stricken. "Mom, I wanted to come visit, but Amanda said we shouldn't interfere with your recovery." "Don't," I interrupted. "Don't make excuses, David. You made your choice. You chose your wife and your unborn child over your mother's life. Sarah chose me when I was a stranger. I know which one is my real family now." Sarah wheeled me past them toward the exit where her car was waiting. It wasn't a private jet, but the sleek black Mercedes felt just as foreign to me as any luxury vehicle would. As we drove away, I watched David in the side mirror, standing in the parking lot with his mouth open, finally understanding what he'd lost. Sarah's house was nothing like my cramped one-bedroom apartment. It was a modern 2-story home in an upscale neighborhood, with floor-to-ceiling windows, a gourmet kitchen, and a guest room that Sarah had already converted into my bedroom. There were fresh flowers on the nightstand and a framed photo of Sarah's mother on the dresser. "You don't have to display that for me," I said. "I'm not displaying it for you. I'm displaying it for both of you. You're not replacing my mother, Margaret. You're honoring her memory by letting me take care of you the way I should have taken care of her." I cried then, real tears of gratitude and relief, and something I hadn't felt in years, being valued. The first few weeks were an adjustment. Sarah hired a physical therapist to come to the house 3 times a week. She worked from home when she could, and when she had to go to the hospital, her housekeeper Maria stayed with me. It was more care and attention than I'd received in decades. David called constantly. I ignored most of his calls, but finally answered one evening when Sarah was at the hospital for an emergency surgery. "Mom, please, we need to talk. I made a mistake. I was scared about the baby and the money, and Amanda convinced me that you'd figure something out on your own." "I did figure it out, David. Just not the way you expected. This doctor, Chen. Mom, is she really your daughter? Or is this some kind of arrangement?" His words stung because they were partially true, but they were also completely wrong. "Sarah is more my daughter than you've been my son in a very long time. She sees me as a person worth saving. Can you say the same?" "Mom, that's not fair." "You're right. It's not fair that I spent 40 years sacrificing for you, and you couldn't help me when I needed it most. It's not fair that a stranger showed me more love in 3 weeks than you've shown me in 3 years. But that's where we are, David." He was quiet for a long moment. "Can I at least come visit? I want Amanda to apologize. She feels terrible about what happened." I doubted that, but I agreed to a visit the following Saturday. They arrived at exactly 2 o'clock. Sarah had insisted on being home, wanting to make sure I wasn't pressured or upset. David looked around the house with barely concealed shock, taking in the expensive furniture, the artwork, the evidence of wealth that Sarah had never flaunted but clearly possessed. Amanda's eyes were calculating as she took in every detail. I'd seen that look before, on patients' family members who suddenly became attentive when they learned about a life insurance policy. "Mrs. Patterson," Amanda began, her voice dripping with false sweetness. "I want to apologize for how we handled things at the hospital. I was so worried about the baby and so stressed that I wasn't thinking clearly." "When are you due?" Sarah asked suddenly. Amanda's hand went to her stomach, which looked completely flat under her loose sweater. December. I'm almost 3 months along. Congratulations, Sarah said, but something in her tone made me look at her sharply. That must be exciting. Have you had your first ultrasound yet? Not yet. We have it scheduled for next week. Interesting. Most OBs do the first ultrasound around 8 weeks to confirm the pregnancy. You're at 12 weeks and haven't had one yet? Amanda's smile faltered. Well, my doctor wanted to wait until… What's the name of your OB? I have a lot of colleagues in that field. I'd love to send over a gift basket. The room went silent. Amanda's face flushed red. I don't think that's necessary. Amanda, David said quietly, something dawning in his expression. Why haven't you had an ultrasound? I told you. The doctor wanted to wait. 12 weeks is late for a first ultrasound, even for low-risk pregnancies, Sarah said, her doctor voice emerging. Most women have them at 6 to 8 weeks. Why would your doctor wait? This is invasive, Amanda snapped. My medical history is none of your business. You're right, Sarah said calmly. But when you used that pregnancy as the reason to deny my mother life-saving surgery, it became relevant. David, does your wife have a history of miscarriages or complications that would explain the delayed ultrasound? David was staring at Amanda now, his face pale. Amanda, you said the doctor confirmed the pregnancy. You said you had blood work done. I did. I took a home pregnancy test, and it was positive. A home pregnancy test, Sarah repeated. Not blood work, not an ultrasound. A test that can show positive results from dozens of conditions other than pregnancy, or from tests that are simply expired or faulty. Amanda stood up, shaking with rage. How dare you question me? I'm pregnant, and we made the right choice to prioritize our child over David's mother. Then prove it, I said quietly. All eyes turned to me. If you're really pregnant, Amanda, prove it. Go to the hospital right now and get an ultrasound. If there's a baby, I'll apologize for doubting you. But if there isn't… Amanda grabbed her purse. I don't have to prove anything to you people. David, we're leaving. But David didn't move. No, we're not. He looked at his wife with an expression I'd never seen before. Mom's right. If you're pregnant, you can prove it in an hour. We'll go to the ER right now. They'll do an ultrasound and this will all be settled. I'm not going to be humiliated like this. The only reason you'd refuse is if there's nothing to see on that ultrasound, David said, his voice getting louder. Oh my God, Amanda, there is no baby, is there? Amanda's face crumpled, but it wasn't sadness. It was fury at being caught. Fine. No, there's no baby. Are you happy now? I said it because I knew if I was pregnant, you'd finally put me first instead of constantly worrying about your mother. The silence that followed was deafening. David sank into the chair, his head in his hands. I let my mother almost die because of a lie. Don't be so dramatic, Amanda spat. She's fine. She found some rich doctor to take care of her. She landed on her feet. Get out, David said, his voice hollow. David, get out of this house. Get out of my life. We're done. Amanda looked at him in shock, then at me, then at Sarah. You did this. You poisoned him against me. Sarah stepped forward, and though she was half Amanda's size, there was something formidable in her stance. No, Amanda, you did this to yourself. You lied about a pregnancy to manipulate your husband into abandoning his dying mother. That's on you and you alone. Now I suggest you leave before I call security. Amanda left, slamming the door so hard the windows rattled. David sat in stunned silence, tears streaming down his face. I'm so sorry, Mom, he whispered. I'm so sorry. I wanted to comfort him, but Sarah's hand on my shoulder reminded me that I didn't have to rush to make him feel better. He needed to sit with what he'd done. I almost lost you, he continued, over a lie, because I was too stupid to question her, too willing to believe that I couldn't help my own mother. David, I said carefully, I forgive you for being deceived. But I can't forget that you were willing to let me die rather than inconvenience your wife or your finances. Sarah, a stranger, valued my life more than you did. That's something we both have to live with. I'll do anything to make this right, Mom. Anything. Sarah spoke up then. There is something you can do, David. Your mother is going to be living with me permanently now. She's not going back to that apartment, and she's not going back to living on a poverty-level pension. I'm setting up a trust fund to ensure she's taken care of for the rest of her life. What you can do is respect her choices and never, ever make her feel like a burden again. David nodded, wiping his eyes. I will, I promise. But as he left that day, I knew things would never be the same between us. The relationship we'd had, where I was always the giver and he was always the taker, was broken. Maybe that was a good thing. 2 weeks later, Amanda filed for divorce and tried to claim Sarah's house as a marital asset, arguing that David had given me money for the surgery that I'd used to ingratiate myself with a wealthy benefactor. It was absurd, but she hired an aggressive lawyer who specialized in finding loopholes. Sarah's response was swift and decisive. She had her own legal team pull every piece of evidence. The hospital records showing she'd covered all my costs personally, the timeline proving David had abandoned me before Sarah and I met, and most damning of all, the security footage from the hospital hallway where Amanda could be seen laughing on the phone minutes after telling me I wasn't worth saving. The case was thrown out within a week. Amanda was ordered to pay court costs and, in a delicious twist of karma, was investigated for insurance fraud after it emerged she'd tried to claim pregnancy-related medical expenses that didn't exist. Sarah and I settled into a comfortable routine. She taught me about her work, and I helped her understand the nursing perspective on patient care. We started a foundation together, using Sarah's money and my experience to help elderly patients who couldn't afford critical surgeries. We called it Second Chances, and in the first year alone, we helped 43 people get the medical care they needed. David and I talked occasionally. He'd left Amanda and was trying to rebuild his life. I helped him when I could, but the dynamic had shifted. I was no longer his mother who existed solely to serve him. I was a woman with my own life, my own family, my own purpose. 1 year after my surgery, Sarah and I went back to County General where I'd worked for so many years. We were there to announce a new program. Free cardiac screenings for all hospital staff and their families. As we stood in the lobby, I saw a woman arguing with the billing department, tears streaming down her face, while her adult daughter stood nearby, looking uncomfortable. I recognized the scene immediately. The daughter was making excuses for why she couldn't help. The mother was trying to maintain her dignity while her world fell apart. Sarah saw it too. She walked over to them, and I followed. "Excuse me," Sarah said gently to the older woman. "I'm Dr. Chen. I overheard that you're having trouble with a medical bill. What's the situation?" The woman, probably in her 70s, wiped her eyes. "I need hip replacement surgery, but I can't afford it. And my daughter says she can't help because she's saving for her son's college tuition." The daughter looked defensive. "Mom, you know we would if we could, but Tommy's education is important." "More important than your mother's ability to walk without pain?" I asked quietly. The daughter's face flushed. "That's not fair. You don't understand our situation." "I understand perfectly," I said. "I was where your mother is a year ago, needing surgery I couldn't afford, abandoned by my child who had other priorities. I understand better than you know." Sarah pulled out her card. "Ma'am, what's your name?" "Dorothy. Dorothy Harmon." "Dorothy, I want you to come to my office tomorrow morning. We're going to talk about getting you that hip replacement through our foundation. And we're going to make sure you never have to choose between your health and being a burden to ungrateful children ever again." Dorothy broke down crying, and her daughter looked stricken. As Sarah scheduled the appointment, I looked at the daughter and said quietly, "One day, you're going to realize what you did here. One day, you'll need your daughter, and you'll remember this moment. I hope for your sake that she's kinder to you than you're being to your mother." We walked away, leaving them to process what had happened. Sarah slipped her arm through mine. "You know what the strangest part of all this is?" I said. "What's that, Mom?" Sarah had taken to calling me Mom all the time now, and it never failed to make my heart swell. If David hadn't abandoned me that day, if he'd paid for my surgery, and I'd recovered in my little apartment alone, I'd still be that lonely, used-up woman who defined herself by how much she could give to an ungrateful child. His cruelty gave me the chance to find real family, to find purpose, to find you. Sarah squeezed my arm. I was thinking the same thing. If I hadn't heard you in that hospital room, if I hadn't been working that day, I'd still be going home to an empty house, eating dinner alone, trying to fill the void with work. You gave me back something I thought I'd lost forever. We stood in the hospital lobby, two women who had found each other in the darkest moment of our lives, and I realized something profound. Sometimes the people who are supposed to love you will fail you. But sometimes, if you're very lucky, a stranger will show you what love really means. David sent me a card on Mother's Day. Inside, he'd written, "Mom, I'm sorry for the years I took you for granted. I'm working on being the son you deserved. Thank you for showing me what real family looks like, even when I wasn't part of it." I showed it to Sarah, and she smiled. "Are you going to forgive him?" "I already have," I said. But forgiveness doesn't mean forgetting. It doesn't mean going back to the way things were. What does it mean then? I thought about Dorothy Harmon, about the 43 other people we'd helped, about the foundation Sarah and I had built together. I thought about the life I had now, full of purpose and love and meaning. It means moving forward. It means building something new and better from the wreckage of what was broken. It means understanding that the worst thing that ever happened to me led to the best thing that ever happened to me. Sarah pulled me into a hug. "I love you, Mom. I love you too, daughter." And I meant it with every repaired chamber of my rebuilt heart.